Another kind of anatomy that is very difficult for conventional EVAR is the highly diseased or thrombus-laden neck. And in fact, other IDE studies typically had an exclusion criterion of 180 degrees or more, or a certain depth of thrombus in the neck, which would not be compatible with enrollment in the study, and also is essentially very challenging for self-expanding technology. Here you can see a patient in the Ovation IDE study in which nearly 50% of the cross-sectional area of the neck includes extensive thrombus. Here you can see a 5-year CT showing the ring, and it's a very stable configuration. We've had several patients like this in the study and many more in registries and other trials for Ovation. Again, this polymeric ring will reach an equilibrium with that diseased neck by basically inflating and conforming that ring to this kind of a shape, and it will not have a self-expanding chronic force which could displace this thrombus over time. And we're not trying to achieve any friction or fixation in this area. We're purely trying to oppose that lumen and create a seal. Again, the fixation is happening suprarenally. So we can treat diseased necks like this because we're only deploying a very conformable seal that does not have chronic outward expansive force, but rather just forms and cross-links a sealing ring in apposition to that segment. There's also some discussion recently about aptus, or using essentially screws to try to augment the seal of a conventional self-expanding device in this anatomy. But as you could imagine, the more diseased the neck, and particularly in the presence of extensive calcium, in this case maybe there's a little bit here, that would be very challenging for essentially a screw or a staple to even access. As I mentioned, oftentimes patients with nowhere near this extent of disease in the neck are excluded from clinical trials. And in fact, no more than 180 degrees is often typically been allowed in IDE studies. It turns out in the Ovation IDE study that about 2/3 of the patients had more than 180 degrees of thrombus and or calcium in the neck.